Hello, and welcome to my presentation. My name is Nicholas Hines. I am the Infection Prevention and Control Supervisor of Georgian Bay Community Healthcare. This presentation is going to focus on health and safety in the workplace, specifically the importance of hand hygiene in the workplace. The learning outcomes of this presentation are going to be an introduction to Georgian Bay Community Healthcare so that you may understand a little more about our company and understand more about the topic of discussion. We will also discuss the importance of hand hygiene, the steps of proper hand hygiene, areas often missed during hand washing, the times when hand washing is required to maintain safe practice, the chain of infection, and promoting the best possible outcome for patients as well as healthcare providers. Georgian Bay Community Healthcare is located in Midland, Ontario. We employ 63 healthcare personnel. Georgian Bay Community Healthcare was founded by Martin Hutchinson in 1996. He is the current CEO and owner of Georgian Bay Community Healthcare. Georgian Bay Community Healthcare offers a wide range of programs and public health services focused on promoting and protecting health and preventing disease, disability, and injury. These programs and services are funded by municipal and provincial tax dollars. One of the many tasks we are required to complete daily is proper hand hygiene to avoid the spread of infection. You may ask, why hand hygiene? This may seem as a tedious task, and you may have already been taught about hand washing before meals and so on. However, what you may not know is how crucial this task is in the healthcare system. There was a study conducted in 2011 about the major sites of healthcare-associated infections. An estimated 157,000 pneumonias, 123,000 gastrointestinal illnesses, 93,000 urinary tract infections, 71,000 primary bloodstream infections, 157,000 surgical site infections, and 118,000 other types of infections were caused by health-associated infection. The total estimated number was 721,000 healthcare-associated infections. The majority of these infections were caused by a lack of proper hand hygiene in the facilities. These infections have affected many lives of many patients and many healthcare providers as well. Therefore, it is crucial to incorporate proper hand hygiene throughout the daily practices of our facility to promote the safest environment for our staff and our patients. Now we are going to discuss the steps involved in proper hand hygiene. First, you must wet your hands with water. Then you apply soap to bilateral hands. You should scrub and lather the soap on your hands for a minimum of 20 seconds, reassuring that you get between your fingers and under your nails. You must then rinse each hand individually and dry each separate hand with a separate piece of paper towel, starting from the fingertips and ending at the wrists. You may then turn off the tap using a paper towel to avoid reintroducing bacteria to your hand. The key points of successful hand washing include scrubbing between your fingers, scrubbing under your nails, and scrubbing the top of your hands. Here's an image of the most commonly missed areas upon hand washing. As you can see, there are a lot of surface areas that are being missed, and bacteria can be reintroduced to the clean areas of each hand. This can cause harmful bacterial agents to be introduced into your patient's environment, which may further harm the patient if he or she is susceptible to these agents. It may also negatively affect the healthcare team if one of the members of the healthcare team are susceptible to these agents. Therefore, reassuring proper hand washing is crucial to avoid the spread of infection and promote the best possible health/outcomes for all patients and the healthcare team. Here's an image that illustrates the moments one should perform hand hygiene. This image was provided by WHO, also referred to as the World Health Organization. First, you should wash your hands before touching the patient. The rationale for this is to protect the patient from any harmful germs that may be carried on your hands. Second, you must wash your hands before performing any sort of aseptic or clean procedure, such as catheterization or wound care. This is to protect the patient from any harmful germs within the environment, including the patient's own germs. Third, you must wash your hands after being exposed to any body fluid. This will protect yourself and the healthcare team from harmful patient germs. Fourth, you must perform hand hygiene after touching the patient. This will also protect yourself and the healthcare team from harmful patient germs. Fifth, you must wash your hands after touching any objects surrounding the patient's environment, even if the patient has not been touched. This is for your protection and the protection of the other healthcare workers within the healthcare team. The chain of infection. This is a term often used to describe how infections may be transmitted from one person to the next. The chain begins with an infectious agent that comes from a reservoir. The infectious agent then enters the portal of entry into the host. The host may transmit the infectious agent through multiple different ways of direct, therefore touching, or indirect contact, which would be touching an object and then contaminating it and then having another individual touch that same object. Certain forms of indirect contact include droplet transmission, which would be sneezing, airborne transmission, which would be particles suspended in air for a long period of time. Example of this would be tuberculosis. Vehicle transmission, which would be sharing a water bottle between two individuals. The vehicle is the water bottle. Or vector transmission, which would be an insect bite. So an insect biting multiple people can transmit different infections through the bite. The infectious agent then exits the host through a portal of exit and enters the susceptible host. Studies have proven that the most efficient way to break the chain of infection is proper hand hygiene. To conclude, healthcare-associated infections are a common recurring issue in the healthcare system. Our goal at Georgian Bay Community Healthcare is to promote the best and healthiest possible outcome for all patients and healthcare personnel. Please remember the 5 necessary times to perform proper hand hygiene and the proper technique of performing hand hygiene. And finally, lead by example in performing exemplary hand hygiene to promote safe practices for you and your patients. If you have any concerns, do not hesitate to contact Georgian Bay Community Healthcare for further information regarding this issue. I appreciate your attention and thank you for your time.